Hello, and welcome back to the Live for Today, Plan for Tomorrow podcast. I'm your host, Gabe Bodner, and I'm excited today for our guest, Don Walford. Don, welcome.
Well, thank you. Nice to be here. Good to see you again.
Well, good to see you, and thanks for being here. Let me do a quick introduction for our listeners and our viewers. But Don is the founder and CEO and the Director of R&D of Nüvo Medical Associates here in Boulder, Colorado. Don brings an unparalleled depth of experience in both finance and healthcare, to include his leadership at Nüvo Medical. His impressive track record includes managing or co-managing over 60 IPOs, over 100 private placements, and has participated in over 500 syndications. Beyond finance, Don has over a decade of experience in emergency medicine, including founding and chairing Boulder County Paramedics. And most recently, he served as the CEO of Core Scans, which is a diagnostic ultrasound company that again is operating in Denver, Boulder area. Don, your diverse background underscores your exceptional ability to lead and innovate in both healthcare and business. Quite impressive, and I'm excited to have you on as a guest today to talk about Nüvo Medical Associates and really what Nüvo is doing in regenerative medicine today. So once again, welcome, Don. Thanks for being here.
All right, fire away.
Fire away, he says. So, Don, why don't you start with telling us a little bit about how the approach at Nüvo Medical is different than traditional care?
So, traditional care, my esteemed colleagues in the surgical orthopedic business, if you go there, you're going to get surgery, and you might get an implant, you might get a replacement, a knee replacement. We're the exception to that. We have had great success using your body's own fluids, compacting them, condensing them for positive mesenchymal cells. They're called. Those are the cells that cure things in your body. We focus them and put them where it hurts, like your knees or your hips or your back or your shoulders or elbows or whatever. And we get very good results on getting rid of pain.
Gotcha. So
quickly.
So to clarify, Nüvo Medical Associates is not performing surgery. This is more regenerative medicine. Is that correct?
It is absolutely not surgery.
What
we do is we draw some blood from the patient, from you, say, and we separate the platelets from the red cells. The platelets are cells that cure things. We compact the platelets with a centrifuge, and then we re-inject it where it hurts. So it basically focuses mesenchymal cells, which, some people loosely call them stem cells. There are stem cells involved, but mesenchymal cells into a fluid called platelet-rich plasma, and we put it where it hurts. And in a week or two, it doesn't hurt anymore. And we have very high success rates.
Okay, so let me break a couple things down. So platelet-rich plasma,
PRP.
So to be clear, for our listeners who have heard of PRP, that's what you're referring to.
Right.
And is this only possible in a joint, or can this be done anywhere throughout the body?
It can be done IV. Which means it can be injected vascularly, and that means that it's very successful after chemotherapy. It's used in the hospital. We don't do that because with chemotherapy patients, they're on the edge of having issues, and we're not trained for that. We're not oncologists.
Sure.
But if you were to take a regular guy, say you or me, and you were to inject PRP, you'd feel a lot better all over.
Hmm.
All our patients who have done that feel better. Some feel a whole lot better.
Amazing. So when you said earlier you have a very high success rate, what does that look like in a percentage possibly?
The FDA says we can advertise 70%. We've done a lot better than that, but in case this gets wide spread information, I'd like to stick at 70%, but we have done better.
Gotcha. So you're talking about FDA. How long has this procedure, if you will, and form of medicine been approved by the FDA?
I don't think the FDA would tell you it's approved, but they say it's okay to do. In other words, they haven't endorsed it, but they are allowing it. And they've been allowing it now for about 15 years, maybe 20 years. And as the data has accumulated, they're more and more comfortable with allowing latitude in what we do. So with the oncologist and doing PRP vascularly, it is now standard of care. It is very good stuff.
So it's been around for a while, 15 years or so at this point, it sounds like.
Which is to say in medicine, 15 years is like an eye blink. 15 years
Okay.
in medicine is not a long time.
Not a
But
long time.
it's long enough. This wasn't pulled off in the last couple of years.
And is this a type of procedure something that's covered by insurance typically?
It can be, depends on how bad your symptoms are. If you're very symptomatic, it can be. Generally, we tell people it's not,
Okay.
and it's not cheap, but it ranges from $1,000 to complicated back procedures are like $8,000, but no surgery, and the recovery time is 6-8 weeks, and surgery on a back, the recovery time can be year and a half, could be a long time.
Gotcha. So let's break down what the procedure looks like then. So you said recovery time could be 6 to 8 weeks. So there's an injection involved, it sounds like, but
Right.
you're also extracting platelets as an
First,
initial procedure, it sounds like.
here's what it looks like. You
Okay.
come into the office pretty much any time before 4 o'clock, 3 o'clock or 4 o'clock, and we do a blood draw.
Okay.
The blood draw, we pull out a bolus of blood. I don't know what a bolus could be 60 milliliters, which is, I don't know if I have a tube here. This would be about, I don't know if you could see this, but this is probably about 10 milliliters.
Okay.
So we pull out 60 milliliters of blood, and then we separate the platelets, which is from so the white fluid, which is the platelet-rich part of the plasma, from the red cells, and then that comes down to about 30 milliliters. Then we condense that into concentrated mesenchymal cells, again with a centrifuge. Takes 4 minutes, and then it's more than that, but then we shake it up and put it in a syringe, and with ultrasound or X-ray guidance, we find, or the X-ray or MRI that usually we have done, we find out where it's hurting, and we inject into that area. And the next day, our experience has been that the next day people feel very much better. That might be partially due to the anesthesia, but so the anesthesia wears off in about 2 days. The anesthesia is like dental anesthesia, really. And I can't guarantee you. I'm sure I could meet the 70% threshold, but most of our patients have found very substantial relief. In fact, some have said, I'm trying to quote them, amazing relief. I found that with a 90-year-old guy.
That's
He-
amazing.
He went out and played golf a week later, and he hadn't been able to play golf for a couple of weeks. No, sorry, couple of months, just
Wow.
hurt.
Yeah.
So this is real medicine, and it
Sure.
works.
That's amazing. So this can be for someone with chronic pain that they've had a previous injury and chronic pain that ultimately, whether it's a knee or shoulder or back or neck, this procedure, in the PRP specifically, you've had high success rates with, obviously.
That's our best application, chronic pain. Yeah.
Gotcha.
Now, if we're not going to obviate the entire orthopedic surgery business, there is a time and a place, and there are chronic conditions that absolutely are going to require surgery and or substantial physical therapy or whatever. And we can recognize that, and we don't even try it. We will refer to the best people for things like that. But the kind of nagging stuff and the chronic stuff and the maybe we do surgery, maybe we don't stuff. That's our area. That's the best stuff. That's where we get the best results.
So, and it sounds like this could be an option for someone to potentially even avoid surgery as a first step to see if there's relief prior to going under the knife, if you will, as well.
And that is the case, and there's no real risk. The sole risk with this is infection, and we are extremely cautious about our lab procedures and our applications and our sterile applications.
Sure. So, and these procedures, by the way, are being conducted in your office in Boulder, Colorado, it sounds like.
Yes, and it takes about the whole thing takes a half an hour if we're really cracking, and 45 minutes if we're slow. And you walk out, everybody walks out, and most people feel relief, right away. It's pretty neat. It's pretty nice.
Yeah, I'm intrigued for myself, by all means. So we've talked a lot about PRP.
I have you on my list of people to call for procedures. You will be a very carefully taken care of.
Oh, I appreciate that. We can talk afterwards more about that. So we've talked a bit here about PRP and that regenerative type of procedure in medicine, if you will. What other types of regenerative procedures, and more specifically, as we look at our demographic and our audience for this podcast is usually over the age of 50. And so as we talk about, again, folks that are over the age of 50 who are thinking about regenerative medicine or longevity medicine, what other procedures do you guys offer that might be a good fit for this age demographic?
We live in Boulder, okay? So the demographic in Boulder is they're very into I don't know. They're into groovy medicine.
Groovy medicine.
There's a lot of that. We are very good at hormones. We're very good at male and female hormone adjustments, which people are finding very much, that's been very good for our patients. We are into hair regeneration, transplantation of hair follicles, which is, I've just put down a down payment on a $400,000 hair transplantation robotics.
Wow.
We are allowed to say that we have a 99% success rate with the follicles that we basically under anesthesia take out of the back of people's heads and put them in where they'd like to have hair, and it looks just like it looked when they were 20.
I find that interesting that you're bringing that up to me in particular at this moment.
There's no direct correlation to the interviewer here.
I won't.
Look, this is me, okay? We have people, women particularly, who have just slightly hairlines are kind of falling away, and we can put their own hair back in long and luxurious, and all that stuff about hair that you'd want, because it's their hair. And we use PRP to stimulate the follicles, because the follicles are individual cells. We insert the follicles into your skin, and then we put PRP on it. The PRP stimulates the growth of the hair, and within about 6 months or 7 months, you're a model for the front cover of a romance novel with the long, the long curly hair. Absolute fact.
Wow, that's amazing.
It's pretty cool medicine.
That is really cool.
But not exactly the anti-aging thing. You just don't look as old.
Fair enough.
You are as old, but you don't look.
Yeah.
Some of this other stuff makes you literally physiologically younger. And that's a very big deal.
And I know you've got a patient waiting for you in the lobby, so I will try and wrap this up. But thank you for being on the show. Thank you for your insights here. That's a great top 10 list for people to live by.
So you're saying this is printable? You can issue this conversation to normal people.
We will try to type out for normal people, as you say, to be able to read in the show notes as you're listening or watching, depending on how you're viewing the show. But with that being said, again, this is extremely valuable information. The PRP is great technology and regenerative medicine that I really do think is great for people to learn more about and explore if they have chronic pain. And again, just how to live a longer, better, healthier quality of life, which is what we're all about here on this show. So again, thank you for being a guest. Thank you for your time and expertise and knowledge and sharing that with us today.
Thanks for having me. Good to see you again. Okay.
Good to see you. We'll talk to you soon.
Bye.
Have a good one. Bye-bye now.